many people who suffer from hip pain, arthritis, or limited hip movement, the only option they've had for relief is a total hip replacement. But Baylor Medical Center at Irving offers something a little different. Joining me this morning to tell us more about anterior hip replacement as a minimally invasive option is Dr. Steven Sanders. He's an orthopedic surgeon at Baylor Irving, and he brought with him Karen McKenzie. She's a patient, and we'll get to her story in just a few minutes. Dr. Sanders, how are you today?
Very good.
Karen, we will get to you in just a moment, but let's talk about this conventional hip replacement option versus the anterior hip replacement, which Karen received.
Yes, with anterior hip replacement surgery, it's a very different procedure than traditional hip replacement surgery. When I was trained 20 years ago to perform hip replacement surgery, typically we make an incision on the side of the hip, extending towards the backside, and then we would access the hip joint from the back of the hip.
Okay.
That involves cutting various tendons and muscles in order to access the hip joint. And so that leads to a much more traumatic procedure for many patients. With anterior hip replacement, we're able to work through a natural window from the front of the hip joint and therefore provide a much less traumatic procedure.
Okay, so conventional hip replacements we know traditionally work, but obviously you said there's nothing minimally invasive about them. So there's benefits going through the front of the hip, is that right?
Yes. There are very many benefits from going from the front of the hip. Because of having to cut those muscles and tendons, that leads to more pain, leads to a longer recovery period for patients. There's also a risk of dislocation because those muscles and tendons help keep the hip in the joint.
Okay.
And so patients they have to be taught how to twist, how to turn, how to sit. Whereas with anterior replacement, those structures are not violated, and so patients have freedom from those restrictions. Also, hospitalization typically is less, usually 2 to 3 days rather than 3 to 5 days.
Okay.
Patients do not require assistive devices such as walkers or crutches near as long, say maybe 1 to 2 weeks compared to 4 to 6 weeks with traditional replacement.
Okay,
And
lots
so
of good news here.
Overall recovery is much better.
Okay, and Karen, you're here today to talk to you about your story. You received anterior hip replacement. What were you going through before surgery, and tell us more about your story.
Well, I suffered from hip pain for years, and I thought it was muscular or bursitis, and finally I got an x-ray which revealed it was osteoarthritis, and the damage was so great after years of dealing with it in the wrong way that it needed to be a total hip replacement.
Okay.
So I talked to my surgeon and a number of people I know who had information. I also did online research, and after I did all of that, I scheduled the anterior hip replacement.
And you are feeling well today?
Oh yes, and the day of the surgery I walked, and 2 weeks later I was climbing stairs. 8 weeks later I danced at my niece's wedding, and 3 months ago I walked a 5K with my family.
Wow, all right.
It's
okay.
terrific.
Okay, we're talking functionality back. This is obviously a woman that was suffering for a really long time, thought your options were limited, and now she's walking 5Ks. That's pretty amazing.
That's fantastic.
Okay, and obviously this recovery time is typical, is that right?
Oh, very much so. This is what we fully expect. Patients have just fantastic results, much less pain and much quicker return to function.
And talk about that table that you use to perform this on.
Yes, we use a special operating table to do the procedure. The table allows us to position the patient properly so that we can bring the hip into the view so that we can properly perform the surgery with reproducible results. Also, the big advantage of the table is that we can use X-ray called fluoroscopy throughout the procedure, which allows perfect positioning of the implants and therefore have optimal results for the patient.
Very nice. All right, Dr. Sanders, thank you so much for being here today. And Karen, congratulations
It's terrific.
on wellness. That's really
Thank
great.
you.
Okay, here's the information you need to know. You can call 1-800-4-BAYLOR, or you can log on to this website, baylorhealth.com/ortho. Over to you, Carrie.